How does blood pressure work? You can't actually feel your blood pressure, but it's one of the body's most important indicators of cardiovascular health. Here's the lowdown on how blood pressure works, and what it means for your overall wellness. If you want more easy-to-understand health tips, don't forget to subscribe to our channel. Your heart is the master pump for all the blood in your body. With every heartbeat, your heart pushes your blood to all the vital parts of your body, such as muscles and bones, through a network of arteries, capillaries, and veins. As blood flows through the tube-like arteries, it presses up against the walls of the blood vessels with varying degrees of strength. The strength or weakness of this pressure is called your blood pressure, or BP. Systolic versus diastolic numbers. Each time your heart squeezes, moving your blood to its various destinations, your blood pressure goes up. This number is referred to by a blood pressure reading as systolic. Then, as the heart relaxes after each contraction, your blood pressure goes down. That is called the diastolic reading. Together, these two numbers are presented as a score, systolic over diastolic. Your doctor might tell you that your BP is 120/80. According to the American Heart Association, or AHA, normal blood pressure should reflect systolic pressure under 120 and diastolic pressure under 80. These measurements are usually determined with an automatic blood pressure cuff. When blood passes under the cuff, the arm increases in circumference ever so slightly, and by measuring the amplitude of the oscillations at a continuous interval of pressures, blood pressure can be calculated. What is considered high blood pressure? If you have high blood pressure, also known as hypertension, your heart is working too hard to pump the blood through your body. The American Heart Association categorizes blood pressure into the following stages. A normal blood pressure reading is defined as having a systolic, or top, number of less than 120 millimeters of mercury, and a diastolic, or bottom, number of less than 80 millimeters of mercury. This range indicates that the heart and blood vessels are functioning optimally, with minimal strain. Elevated blood pressure occurs when the systolic number falls between 120 and 129 millimeters of mercury, while the diastolic remains below 80 millimeters of mercury. Although not yet classified as high blood pressure, this stage signals an increased risk of developing hypertension if lifestyle changes aren't made. Stage 1 hypertension is diagnosed when the systolic reading is between 130 and 139 millimeters of mercury, or the diastolic reading is between 80 and 89 millimeters of mercury. At this stage, doctors may recommend lifestyle modifications and possibly medication to prevent further complications. Stage 2 hypertension is more serious, with a systolic reading of 140 millimeters of mercury or higher, or a diastolic reading of 90 millimeters of mercury or higher. This level of blood pressure often requires medical treatment and close monitoring to reduce the risk of heart disease and stroke. A hypertensive crisis is a medical emergency. It is defined by a systolic pressure of 180 millimeters of mercury or higher, or a diastolic pressure of 120 millimeters of mercury or higher. Immediate medical attention is necessary, as this condition can lead to organ damage or life-threatening complications. According to the American Heart Association, elevated blood pressure is 120 to 129 over less than 80. Hypertension stage 1 is 130 to 139 systolic, or 80 to 89 diastolic, and hypertension stage 2 is 140 or higher systolic, or 90 or higher diastolic. If your blood pressure hits 180 over 120, you're in hypertensive crisis, and you should seek help immediately. If your systolic and diastolic numbers fall into the elevated or hypertensive categories, your doctor will recommend changes to your diet and physical activity routine, and possible medication. High blood pressure can be a side effect of other diseases, such as diabetes, and if left untreated, high blood pressure can lead to heart attack, organ damage, stroke, and other serious issues. In addition, your blood pressure can temporarily rise due to stress, pregnancy, and even some common medications, including over-the-counter pain relievers and antidepressants. One high reading will not necessarily mean you have hypertension, but it's good to be vigilant.